interested in creating long-term value for your organization? Would you be interested in creating long-term value in your health plan? Forward-thinking employers are applying long-term value strategies to their healthcare budgets with positive results. My name is Allison DePauli, and I started Altiqe Consulting to help employers like you take control of your healthcare spend and get budgeting predictability. The happy side effect of that is better access to high-quality care and lower out-of-pocket costs for your employees. If you like what you find here, hit the subscribe button down here and hit the notifications bell, and we'll let you know when we upload new videos. CFO Magazine just had an article about long-term value creation, and most CFOs are tasked with this. And one of the recommendations is to create a cash management office, and talks about how that can help increase the odds of success for a value creation program. A value creation program typically touches almost all areas of a business: labor cost, operating cost, customer and product optimization, labor productivity, and working capital. So it's a lot, right? And pretty diverse. Creating a working group to look at the process holistically and not in a silo or silos can be incredibly effective. It helps you see how all the components work together and helps you flip the levers most effectively. You can do the same for your healthcare budget. And healthcare budgets have a lot of long-term value to extract. Let me show you what I mean. The workflow of a cash management office looks something like this. Use of analytics to determine achievement levels or whatever number you need to get to. Qualifying and prioritizing opportunities to meet the goal. Identifying key performance indicators, metrics, and incentives. And forecasting results. Let's talk about how you do this same process with your healthcare plan. Number one, use of analytics to determine the achievement levels. Do you know your per employee per year claims cost? If you're self-insured, divide your claims costs only by the number of employees only, enrolled. If you're fully insured, multiply your premium by 80%, then divide by the number of employees enrolled. This is your starting point. I see a lot of manufacturers and skilled laborers with per employee per year costs in the $6,000–$7,000 range in Texas. That'll be higher in other areas. A well-managed plan should run a fair bit less than that. So set your target. Where do you want to be? 5,000, 4,000, 3,500 per employee per year? What about 2,800? All doable. Now you've got your achievement level. Qualifying and prioritizing opportunities in your health plan simply means looking at your data, I know you've heard me say it 199 times, and seeing what claims are driving your costs. Next, identify key performance indicators, metrics, and incentives. For me, this is the fun stuff. This is where you decide, yes, you decide what level of quality care you want delivered to your employees. You can make sure that all care is delivered by a provider that meets or exceeds your metric. Do you want all care delivered by providers with an A and B quality rating, or maybe only an A quality rating? You decide. Do you want to pay a fair price for prescriptions and see what the pharmacy is being paid? This is possible today. And it's the only way you can identify what the third-party pharmacy revenue is and if you are receiving all of it back, or if one or two middlemen are hanging on to it. Do you want to incent your employees to go to the highest quality provider? You can do that today also. While that may save your employee a few $1,000s, it can save you tens of thousands of dollars. Finally, forecasting results. Each quarter, or at least twice a year, you can review your plan performance to see if you are meeting your quality metric, if your employees are getting all the care they need to keep the shock claims down. You want somebody with diabetes to go to the doctor, take an appropriate medication regimen, get their eyes checked and their teeth cleaned. This is a low cost on an annual basis and much better than them showing up in the emergency room with an ulcer on their foot and spending $40,000 of your money and maybe losing a foot. If you're paying the right price for medications, and if you are paying the right price for J-code drugs. J-code drugs are those drugs delivered in a hospital or infusion setting that run through the medical plan, not the pharmacy plan. It's an area of consistent and almost unstoppable abuse. Unless you look and manage, your budget will also flatten and often follow a downward trend. And remember this should be done by your providers, your insurance company, your third-party administrator, your PBM provider, your advisor. We'll give you questions to ask below. We have a new guide called the Executive Primer. They're a great place to get started. And if you're interested in leveling the playing field and making your healthcare plan work for you and your employees, click the link below and let's talk.